Startup Podcast PH is co-produced by Sprout Solutions. Check out our partners in the description. Startup Podcast PH is at ENSPACE Cebu and will be interviewing startups from Cebu. In this episode, we have SugboDoc, a global cloud-based EMR or electronic medical records platform, and its founder and CEO, Ryan Michael Gelig. Hello, Ryan. Kamusta?
Kumusta, Chani? Thank you for having me. And to all your viewers of Startup.ph podcast, magandang hapon sa inyong lahat.
Yes, I'm very happy to have SugboDoc here. So it's a healthcare startup based in Cebu, ano, pero you're also global, ano. So
Yes.
can you tell us, Ryan, so ano nga ba ang SugboDoc?
Yes. So SugboDoc is a global healthcare platform that allows doctors, clinics, and healthcare facilities to sign up as a software as a service and set up an online clinic or a healthcare facility and then
Mm,
manage their patient records, electronic health records like e-prescriptions, invoices online.
Ayan, so marami tayong pag-uusapan diyan, ano. Simulan muna natin yung problema ng healthcare industry and why you're offering this solution, why you're building this startup. So ano nga bang kumbaga parang estado or state ng healthcare industry maybe in the Philippines or in Cebu? Bakit kailangan ng ganitong global cloud-based EMR platform?
Right. So actually, the problem here in the Philippines, most people really experience when they go to a clinic or when they go to a doctor, they have to go queue up, no? A lot of people ahead of them, and then when they visit the doctor, records are still paper based,
Yes.
no? So they have to also bring with them their diagnosis, their previous prescriptions, their lab tests, no? And if you miss a lot of those records, you actually miss information that could have helped the doctor give you a better diagnosis and treatment.
Hmm,
And most of this could have been avoided
hmm.
had there been like a digital platform.
I see.
Yeah.
So parang ano
Mm.
siya 'no, may efficiency
Mm.
tsaka may kumbaga yung effectiveness. Kasi for example, tumatagal nga paghahanapin pa yung mga dokumento, paghahanapin pa yung mga paper-based na documents and
Yes.
aalamin pa nung nurse or nung doctor yung
Mm.
like previous na conditions, previous na ano visit sa mga hospitals and
Mm.
effectiveness din kasi of course if may information ang doctor, if may tamang information,
Mm.
mas tama yung mabibigay na diagnosis, na instructions.
Correct.
So
Yes.
So how does ano naman, how does SugboDoc naman work as an EMR platform? And what really does EMR mean?
Okay. So EMR stands for Electronic Medical Records. So in the international community outside of the Philippines, especially in the US, in Singapore, in Australia, in Europe, uh, it's heavily adopted really. A lot of doctors, a lot of clinics already use an EMR platform. They use it for entering their prescriptions, managing all the patient data like demographic information, all the service requests, mga lab results. All of it is can be uploaded or digitized. Also with their bills like invoices, it can also be used to aggregate all their information. In Singapore, for example, they have like a health information exchange so that different healthcare providers like clinics, they actually use like health data repository by the government. So in-aggregate siya by the government and the next doctor that sees the patient, makikita niya yung records
Yeah.
ng pasyente.
Yeah. So there are many questions here,
Yeah.
ano. Later I'll ask about like the challenges kasi you're building this as a global cloud-based so the information is stored in the cloud then of course by privacy
Yes,
and it's
yes.
global, kumbaga globally accessible siya. But before
Yes.
we go there, can we demo lang Ryan yung how does the platform look like and maybe parang paano nga ba siya pwedeng magamit ng doctors, ng
Yes.
nurses, ng hospitals, ng healthcare. So can we show us the platform and how it can be used? So
Sure.
meron po tayo ditong
May
demo.
we have a demo here
Yeah.
of our platform.
Ayan.
So nakalagay na siya as a doctor. So
Lapit
what
natin ng
we're
onte.
trying to show you now is the patient work list. So dito sa interface natin, this has some of the features that we have. These are the dashboards, this is the work list, and then these are the within the work list. For example, this is the patient list of the doctor. So he can look at all patients of the facility, no, or only his patients. For example, dito. No? So you can also look at his own appointments that have been recorded by the clerk or yung doctor mismo or the patients, they can book online. So dito, balik tayo dito sa patient list. So if I click on a patient, the doctor has a bird's eye view of all the latest records. No? These are the records of his latest vitals, some of the soap notes, subjective, objective assessment plan. Then some of the prescriptions, yung mga medications na prescribed niya, the service requests, which could be the imaging, imaging and lab results, no? Lab requests, sorry. And then the diagnosis entered by the doctor. This shows the procedures done at the facility. This also shows the appointments of the patient, uploaded file, and the encounters, the list of encounters. So what we call the visits actually of a patient to a facility. So really, and of course, lastly, the financial records of the patient, which is the bills and payments. So within this, you can actually add any of these records. So role-based access control, we have different roles in the system. So they could be doctors, we could have like the secretary or the clerk, and depending on their role, they have a limited access depending on them. So my patient privacy is preserved.
Yes.
So let's say, for example, we want to add an invoice of the patient, or let's say we try to do a call, because the system can also do teleconsult with the patient.
Wow, amazing.
So if I like click on this, let's see, like I can do an instant call with the patient.
Oh, video call.
Yeah, video call. And let's say the patient has actually triggered an emergency because of let's say high fever. Okay, so this is the reason of the call. The doctor calls the patient. A link is sent to the patient, and the patient clicks on the link. The doctor
the link is sent to like the email or also to the app, to the platform for the patient.
Both. So it will be seen on the patient's own app. The link, it will be sent as an SMS as well as an email. So para alam talaga ni patient. So this is the video. So the doctor can join the call. And here, this is my
so
my
connected
patient
pala
is
tayo
in-
dun sa patient.
Yes.
So we have the patient there.
The patient is actually
I see.
yeah.
So it's
So yeah. And then while the call is ongoing, they can converse with the doctor, and then the doctor can actually enter the medical records. Also,
so habang nagko-consult din, andun na-record na rin information digitally, right?
Yeah. So while the call is ongoing, option sa kanya. He can record it later or during the call. So you can just click to redirect these things, or even bill the patient back. From this, for example, we can enter the soap notes. Pupunta tayo ulit dito sa patient work list, and then pwede siya mag-enter ng mga records like soap notes. And when I said aggregated information, di ba? So makikita niya yung lahat ng information. So if I wanna like investigate, okay, what happened in previous encounters, I can just click on that record and view all that information. It's all here.
Yeah.
So really, the patient can also choose if all his records across all facilities will be visible. So the patient takes control of his privacy. Kasi it could be na the patient only wants na yung doctor niya that he's currently seeing will have access to that specific record, or all of the previous specialists or practitioners or his care team will be able to see the records. So the goal is to aggregate all records so that the practitioner has a complete view of the patient's health information to give the proper diagnosis and treatment. So it improves the care coordination of the
so that's actually powerful. So it's an aggregated information database, but in the end, controlled ng patient, nung tao, nung parang healthcare consumer, yung kung sino makapag-access sa kanyang data.
Exactly.
At the end,
Exactly. He could be very private. So ayaw niyang accessible siya ng iba. Or he wants na there's some correlation between his previous visits in doctors, and maybe the diagnostic tests
Yeah.
could be better analyzed when they're aggregated, and i-on niya lang yung
Yes.
visibility.
Oh,
Yeah.
amazing. So it's like an
Yeah.
all-in-one nga no,
Mm.
database and
Mm.
also yung kumbaga you can also call,
You can
meron
also
din
call.
ganung feature yung platform.
Yeah.
On the usability,
Mm.
so this is a
Mm.
SaaS, right? Parang
Mm.
doctors kumbaga
Mm.
can subscribe to this platform for
Yes.
for a cost, but they can
Mm.
use you can use this system. And for the patient then, right? So how does it work like operationally?
Yeah. So the patient actually can register to sign up. Actually, our 2.0 is up soon, because right now for the longest time it has been running on version 1.0, which is a B2B, where the doctors can register the patients lang. So there's no
Ah,
registration from the
okay.
patient side. They cannot register themselves. But soon, the patients will be able to register using his Facebook account or Gmail, a mobile number or email, and he will have access to his patient records. So
Mm.
aggregated na siya. It's
Mm.
all of the records
Mhm.
across all the facilities. Yeah.
Yeah,
Mm.
actually what I want to
Mm.
ask her
Mm.
kanina nga ano, yung parang challenge
Mm.
dito kasi siguro i-ano na muna natin 'to 'no?
Ay, sige,
Okay
sige.
na yung demo
Mm.
natin. Kasi yung isang challenge din like,
Mm.
first of all, healthcare information,
Mm.
healthcare data is
Mm.
very private, it's very sensitive, right? So,
Exactly.
kaya
Yes.
din
Mm.
nagkakaroon ng problems like in
Mm.
the national healthcare system
Mm.
sa Pilipinas kasi hindi tayo gano'n ba ka-aggregated kasi
Mm.
private kumbaga private din yung hospitals. I mean, kanya-kanyang private companies. So,
Correct.
wala pa tayong parang national na magko-correct ano. So, what's your opinion on that na on like how challenging is it to run a database like this na parang it's really accessible from different like government run hospitals, private hospitals. So,
Right.
what do you think about that aspect lang?
Yes, we have to abide by data privacy laws of the Philippines, and which means that really the patient takes control of his own privacy.
Yes. Actually, that's
Uh,
the most
it's a
powerful thing here because
yeah,
the patient has ownership,
has
has
ownership.
control
Yeah,
on his or her data, right? Yeah.
exactly. Just like when you visit a doctor, diba? You might be given a prescription. So your prescription na yun, it's now the patient can pass it to the pharmacy,
Actually,
etc.
say
Diba?
actually get
'Di ba?
oo.
So it's just aggregating that information, 'di ba? And the
Hmm,
patient takes ownership of that, whether to
hmm,
share it to whoever he wants to share.
yes.
So data privacy laws, we still have to abide by it, and as well as uh, actually with the universal healthcare law that's been
Hmm,
implemented,
hmm,
there's a mechanism or a framework where health data is going to be aggregated really by the government eventually through the National Health
hmm.
Data Repository.
Yes, actually.
Yes.
Yeah,
So
speaking
it's
of
a law.
yeah,
Yeah.
yeah.
Mm, mm,
So
mm,
actually parang ano nga 'no, yung mga papel,
mm,
yung mga records na
mm,
papel ngayon ay nung mga patients ay
yes.
online na
Mm,
and ang kinaganda dito yun nga, puwede mo ibigay kung aling papel lang yung gusto mo ipakita sa
yes, yes.
doctor sa ano.
Mm,
Speaking about that very powerful kumbaga benefit naman
mm,
of having this system, you also showed me kanina na
mm,
parang merong puwedeng large analytics na magawa dito ang government like if you have
mm,
this data
yes.
puwede pa rin naman ma-secure, eh, like yung
Mm,
personal information, right? Pero
mm,
like if you have like kumbaga yung big picture ng healthcare data. So,
right.
ang daming puwedeng magawa, 'di ba? Like for example, government policies,
Mm,
the hospitals can actually maybe change,
exactly.
to do
Mm,
some policies rin. So,
mm.
ano yung parang larger maybe, implication din of or use of having like a database like this?
So also part of our goal is, and it has to be, the patient has to agree on these terms as well, is
Yes,
that
yes.
when they sign up on the platform, their data will be anonymized and
Yeah.
aggregated.
Yeah.
Meaning, for example, they would have, let's say, a data point of their illness, their diagnosis like dengue. No, we aggregate that information, but it's detached from any patient linkages. Aggregated la siya. So ilan yung dengue, ilan yung mga may heart problems,
Hmm,
ilan yung mga may high cholesterol, and we aggregate that information. Diagnosis is just one aspect of it, as well as all the medications that have been prescribed or ordered in a healthcare facility, the service requests, yung mga imaging, yung labs na tinake niya, and even the lab results.
hmm.
No? So for example, a data point niya is CBC results, WBC, blood sugar throughout the years. And once it is aggregated, no, anonymized, aggregated, a few benefits will
Yeah.
be mentioned, as you
Mhm.
mentioned also, no, faster drug research and
True,
approval,
true.
personalized medicine. So
Mm,
medications, medicine, treatment that is tailor fitted to your profile, your healthcare profile,
mm,
no? And once DNA is also added into the mix, no? Which is also like part of our long-term roadmap, no?
mm,
It's really personalized care that's given to you.
mm.
There's also better healthcare policies, no? Better policies that can be put into
Yes.
laws in our national, our Senate and our Congress. It can also improve our resource allocation to optimize the deployment of uh, healthcare personnel. For
Mm,
example,
mm,
there might be areas that are underserved, maybe the mountain areas, mountain
mm,
barangays. Um, some areas that probably have uh, didn't really take notice by government because sometimes no data has to go through many levels. No, sometimes it's aggregated manually. Diba? It's paper based right now, so it has to be aggregated from the barangay level, then to the city, then to the province, and then maybe to the national level.
mm,
And only then we'll be able to have a good picture
mm.
of the situation, the dire situation. No? If there's
Yes.
something that's problematic, then they will only realize it like several months have happened. Let's say there are dengue cases, no, in a mountain
True,
barangay,
true.
no.
Mm.
So it takes a long time to
Mm.
aggregate.
So, puwede ka rin ma-profile yung
Uh,
mga different regions, areas, tsaka puwede ngang ma-alarm agad kapag may nangyayari na palang something. So, it's also
yes.
like it's
Mm.
also like the public health aspect, right? Yeah.
Yes. There's a public health aspect because the local government or the public health agency also has a log into this, and
Mm,
they will be able to see
mm,
anonymized information like
mm.
ilan na yung mga top diagnosis, ano na yung mga top na medications
Yes.
na order,
Mm,
no? So those things, the
mm,
things where they can actually take action.
mm.
Is payroll processing taking too much of your time? Introducing Sprout Payroll Starter. For as low as 5,000 pesos per month, you get a team of experts to help you with your payroll and HR needs. We'll help compute and process payroll, handle all your government compliance requirements, and automate timekeeping. Leave the payroll to us so you can focus on growing your business. Enjoy peace of mind with Sprout Payroll Starter.
Amazing. This is actually very big. I mean, this is
Mm,
actually very, very huge. So, yeah, puntahan naman natin,
mm,
Ryan, yung
mm,
some background about you because you're doing this very, very, very big thing. So,
mm.
can you know more about your background and why are you doing SugboDoc? So, what's your experience like maybe in the healthcare industry?
Yeah,
Napagkwentuhan na tayo last
yeah,
time, ano?
yeah,
So,
sure.
I
Yeah.
know a bit of your background. So, can
Mm.
you tell that to our audience?
Yeah. So basically, I've worked in Singapore the past 12 years, no, prior, and that is where I really saw how Smart
You work
Nation
in
works, no.
Singapore hospitals? Health?
So I've worked 7 years of that. I've worked in designing healthcare systems such as telehealth,
Mm,
nursing home, ambulatory facilities, and also a hospital. So designing healthcare systems isn't new for me,
mm,
which means that I was really exposed to how to design a modern healthcare system,
mm,
no? And much, especially coming from Singapore, where also we worked with various entities, healthcare entities in Middle East, in Australia, in the US. So we were really exposed to what are the needs of various practitioners and what are the laws that are
mm,
regulating them. So um, after having experienced that, when I went back to the Philippines, having seen how dire our situation is, I was inspired, as I also like took charge of caring for my patients,
mm,
retiring patients, parents, and
mm,
uh, I really saw that there's really that
mm,
disparity in
mm.
the level of care, having to bring all those paper records and
But
stuff.
what's your
Mm,
background pala?
mm,
Like, like academic background?
mm.
Are you the healthcare, or is it like engineering?
Yeah. So like I graduated as electronics and communications engineer from UP Diliman, and
Oo.
then I took my master's in National University of Singapore in
Hmm,
management. And it is then I was also working in various industries
hmm,
like in semiconductors,
hmm,
in designing tests for microprocessors. We actually also designed like the very first test for the very first 6 core server microprocessor in AMD in Singapore, it was there that I really saw the level of the volume of data that you have to test and see correlations from. Imagine billions of test data, no, functional tests, parametric tests about a processor, and that is how we also looked at how it can be correlated and used within a healthcare context. No, especially the human being is actually just a huge machine with certain you can digitize, and the tests you can actually analyze.
So Ryan actually is an engineer,
I'm an engineer,
but
yes.
he's building this for the healthcare system. I mean, it's
Yes.
really nice. It's really nice, like building proper working systems
Yes.
for different industries in the Philippines. Like for example, ito nga sa healthcare.
Right. Yes.
Who's the team behind SugboDoc? So how did you form the team? Like co-founders? Yeah.
Yeah. So basically, I have a chief medical officer. When I came back to the Philippines from Singapore in 2020, saw the need. I formed a team, called a few of my friends, and they've basically helped out. One is really a serial entrepreneur also. In Singapore, I called in up also a few of my friends from the US who was in studying biologics. They were doing medical research in pharmaceuticals, and also some of my friends in the medical industry here in the Philippines, some specialists, pediatrician, cancer, and some surgeons. We were linked up with them and basically studied really the problems that they've faced, what their current processes are. And that is where we actually built the gap. That's when it all started.
And how are you approaching like the hospitals or doctors? Are you approaching like the hospitals directly or the doctors directly, or maybe the government, the LGU? So how are you approaching? Kumbaga, like in a business sense, these are the clients din pero parang these are also like the users of this technology, of this platform. So how are you approaching them?
So it was in 2023 when 2022 there was this event where I was introduced to a common friend. We actually were also introduced, where he introduced us to Department of Health. And it was then when they were very proactive, they were very helpful, showed us all the different healthcare platforms that they use for the barangay health stations, for hospitals, iClinics, iHomies, their telehealth solution as well. Told us about the problems that they're all different systems, no? And also not aggregated, not interconnected. So that's when we saw an opportunity also to make it a bigger platform. Why not just look at the problems and solving it for practitioners, but looking at the problems of government and how can we solve it for the government. And from then we were introduced to we worked our way up from the PhilHealth nurse. We were introduced to a PhilHealth nurse, worked our way up, and then we were introduced to key people in PhilHealth. And we also looked at the problems that we were facing, and some of the hospitals that we've spoken to and facilities, they were actually getting some of their claims were taking a very, very long time. Some take more than a month to arrive, which means that those claims actually brings down, as the accounts receivable of facilities extend. So that's like pera yan na hindi nila nagagamit, di ba? Which means that they will have to, in a way, pass on the cost to the patients, maybe through higher fees eventually. So we saw that a lot of the PhilHealth processing is also manual. You can think of claims as like, when a patient goes to a doctor, sometimes, he's eligible for he has insurance, either private or maybe for PhilHealth, so he doesn't pay. So initially, it is borne by the facility, who then raises a claim to the insurance provider, let's say MaxiCare or maybe PhilHealth, who would then look at the eligibility of the patient and then look at the amounts that they're claiming for, and then ano yung mga diagnosis, ano yung mga maximum benefit limits.
Yeah.
And then once all is approved, then they issue a check to the facility. So that entire process actually takes a long time. So we also saw that problem when we spoke to Department of Health and Mental Health,
Yes.
as well as the hospitals. So we also attempted to actually solve that problem. And
Yeah. So actually, this is very huge, and I mean implications wise, parang I mean government, also insurance,
yes,
dealing with insurances, doctors, patients. So this is actually very groundbreaking in the healthcare industry.
I hope so. That's the vision that we want to build, and that's why it took us a bit of time to really build this.
How about like the adoption? Kasi maybe some, for example, public hospitals, like government. I mean, even private hospitals. Maybe they're somehow hindi sila ganun kadali to adapt to this change in technology. Like,
Yes.
what do you have to say about that?
So all in all, based on our interactions, more than 90% are still not digitized. So can you imagine that? In some form or another, their records are paper-based.
Yes.
So they have to pass on like their charges, no? And maybe the results are not digitized then. So it's all like on image, and their lab results also printed, passed on to the patient. So their hesitation for that maybe is the cost, maybe initially. Cost to migrate all that data. But they actually don't have to initially. When they adopt a system, they can just use that, and then moving forward,
Fresh new
they
data.
digitize. Yeah, fresh new data,
Okay.
right? And then just do the migration of the data bit by bit. No? So that's, I think, cost is always a constraint. Second is a lot of training that's needed. A lot of our healthcare practitioners, a lot of our users need a lot of training because it's not yet in our educational system. Much of our educational system, especially those trained in nursing, our medical doctors, they're not trained in using like an EMR system.
Information systems, I mean, like that.
Information systems, which means that there's a lot of work that really need to do. Which means that we have to like work with educational institutions, build a training program for them, invite a few more experts, no, so that we bridge the gap for the
And kasama rin pala dito yung mga nursing schools, med schools, kasi somehow they also need to adapt to like in their curriculum yung pagpasok ng mga information systems, ng mga digitized platforms like this, maybe in their trainings.
Exactly. And which means that the platform, and with training as well, they also have to understand that there are some standards. Standards are like interoperability standards. So for example, yung diagnosis. When you say diagnosis, some system, when you enter it on paper, you might write it, okay, you have fever, or you might have dengue, no? But actually, there's a standard for diagnosis like ICD-10. It's International Classification of Diseases. There's also a standard for your healthcare events, your symptoms, your allergies, your medications. There's a lot of standards, no? Many of the systems that we have in place in the Philippines are just, free text. But actually, there are codes for that. And if you abide by some international standards, madali na lang i-connect yung mga yan.
Oh, gets. Okay. I'm learning a lot here.
Yes.
I'm learning a lot here.
Thank you, Johnny.
So you're based in Cebu, right? And nagsimula rin sa SugboDoc sa Cebu. But of course, you're talking to like the healthcare industry all over the Philippines, right? So so how are you planning to build SugboDoc really? So are you approaching it on a national scale na kaagad, or are you starting muna here in Cebu?
So with version 2, that's going to be released soon. Just wait for announcement on our Facebook page. It's going to be up soon. Version 2 will allow us to scale very fast because it allows doctors to like sign up, just like signing up for a Facebook account. They can sign up and set up their own online clinic with whatever some configurations that they want easily. And then for patients, they can also sign up, link their accounts, and for there might be some practitioners or doctors who might need demos or training, then we will provide that for them. And it will be of a global nature, which means that we will be running ads. We will be aggressively doing that. We've designed it so that it is multi-tenant. It is language for the meantime. During the release of 2.0 is English. But it will be in multiple languages soon. It is also multi-time zone, which means that if a doctor signs up somewhere in like in Taiwan, for example, or in Europe, they use the in their country they would have different time zones. When they view the schedules, they will also it will also be adapted to their time zone. So ano siya, hindi siya yung when you look at the patient's appointment who they booked from you for you, no? Hindi siya sa patient side, as in it's really translated to the user's location.
Yeah.
Yeah.
And it's truly global. Global talaga yung
It's a
use
global
niya.
platform, yes.
Ayun. So, final question,
Yeah.
Ryan. So, what's really the vision for SugboDoc? Like, what's the, kumbaga, yung roadmap nyo pa in like farther, like more years? So, what's in store for us in the future for SugboDoc?
So we really built SugboDoc, started it with a vision that we build systems to make quality healthcare accessible and affordable to everyone. No, we're passionate about connecting with patients, addressing their needs, so that we all have happier, healthier, longer lives.
Yeah.
Yes.
And by the way pala, I have to ask, kamusta ang Cebu startup ecosystem? So, you're a startup founder and also an ecosystem builder here in Cebu. So, kamusta ang startup community ecosystem dito sa Cebu?
So I think it's in the nascent stage, but it's a very, very helpful community. I've interacted with a lot of founders, a lot of people helping startups, a lot of investors as well, a lot of people passionate in building startups, helping grow them. You know, and they're very passionate in connecting us with the right people. It's vibrant. Us founders, we also like connect regularly, maybe over one bots. We call that one bots, meaning one bottle. It's like a tradition that we have so that we can bounce ideas, bounce up our stresses, our problems, how we approach things, right? And overall, it's a very it's a community that really drives you to excel, drives you forward. It's very nascent, which means that the definition of startups, we really need to introduce it still to maybe more investors so that they know about the needs of a startup and the opportunity for making sure that startups thrive and grow and how it would benefit them and the larger community. And everyone as well, not just investors, but also startups, maybe some of the students, to help them transition, not just to work in traditional companies, right? But also like maybe found something that is scalable in technology and, maybe innovate and also like disrupt status quos.
Ayun. So, maraming salamat, Ryan, for this conversation, sharing about your background, SugboDoc, and kumbaga ano yung larger vision nito for the healthcare industry in the Philippines. By the way, if
Thank you
our
so much.
listeners and viewers want to know more about you and SugboDoc, so how can they find more information? Maybe you can lead them to the website or social media channels.
Sure. So we're on Facebook. Just do search on SugboDoc. We're also on SugboDoc.com, our official platform. And stay tuned for our official 2.0 launch coming in just a few days.
Ayan.
And
malapit
sign
na.
up for a free trial.
Ayan,
Yes.
so for clinics, doctors, hospitals, anyone in the healthcare industry, patients even.
Patients, yes.
So stay tuned sa launch ng 2.0. Actually, baka pag na-release itong episode na to, na-launch na yun.
Na-launch na, yes.
Baka
Probably.
na-launch na.
Yes,
So,
yes, definitely.
go to their website and social media channels. And thank you very much, Ryan.
Thank you very much, Johnny. I'm very honored to be part of this podcast. I love what you're doing. Congratulations.
Salamat.
Thank you very much to our 45 patrons. This episode is super powered by AskNextPH Academy, our official e-learning partner. Get certifications on Lean Six Sigma, project management, data science, and more. ROC.ph, our creative marketing partner. Get unlimited digital marketing services monthly. One CFO services, bookkeeping and tax, and payroll processing for startups and small businesses. ENSPACE Cebu, global co-working space, private office, and meeting rooms for startups, digital nomads, and freelancers. Tuala, privacy-focused digital experience for sharing identity information across Web 2 and Web 3 ecosystems. Mamiki, super Super Pet App, the Philippines' first ever one-stop mobile app for pet products and services. MarketMind Local, a digital marketing company focused in helping small and medium businesses. Mata Technologies, Philippines' premier provider of virtual tours and maps for LGUs, real estate, tourism, and private businesses. Hire Business Solutions, provider of the most configurable cloud-based payroll system in the Philippines. Smile, consent-driven digital employment verification service to make smarter decisions faster. DVCode Technologies, IT solutions specializing in software development, blockchain smart contracts, digital wallets, and cybersecurity. Drive Manila, PH's largest peer-to-peer car rental community. Ignite Careers, career matching platform for Filipino talents and hiring companies in the outsourcing industry. Looking for buy and sell online with Sigurado sellers. NutriCoach, personalized nutrition and weight loss programs for you. Benjoy's Food Products, the home of premium bacon ends, tapa, and tocino. This episode is powered by Contact RFID Business Cards, Jur.ph, Big Giant Games, Founders Launchpad, Packetworx, Uplift Codecamp, Pareto Consulting, Agile Data Solutions, Hassle.ph, Board Prep, Zayls, SeriousMD, Pahatid.ph. Please support the podcast through the links in the description.